Well, good afternoon. If you're watching us live on Facebook this afternoon, want to welcome you to another series, another interview in our series that the Nonprofit Partnership has been hosting for probably a few years now. See, time flies when you have fun. We call this series Our Stories, Our Time. So, welcome if you're watching us. My name is Carolina Quesada with the Nonprofit Partnership. And in this series of interviews, we get to meet nonprofit leaders who are, just doing amazing work in the community. We want to understand how organizations are navigating current times. There's been a lot of challenges for everyone in our society. But in particular in the nonprofit sector, there have been a lot of challenges to keeping programs going and activities and all manner of ways that community members are engaged. So this series really tries to understand more from those leaders in the community, practitioners in the field, how things are coming along, how they're doing in these current times. Now, before I introduce our guest today, I'm very excited to introduce her, but I do just want to take a quick moment to, on behalf of the nonprofit partnership, thank and acknowledge the contribution of the Port of Long Beach in ensuring that we have these series that really highlight stories from the community. So, Port of Long Beach, thank you very much for your contribution. And with that, Ernesta, I feel like saying, Ernesta, take it away. But this is Ernesta Wright, Executive Director and founder of the G.R.E.E.N Foundation. And I'm so excited that we get to talk about the G.R.E.E.N Foundation today. So Ernesta, welcome. It's a pleasure to share, kind of the next moments with you on this video.
Great. Thank you, Carolina, for this invitation. And I'm honored to be able to share in this space. And I appreciate the nonprofit partnership in giving us this opportunity to share our story, right? And to share the work that we're doing and the work that helps support all of our partners to get us to this space. So I am Ernesta Wright, with the G.R.E.E.N Foundation. I am the executive director, and I'm very proud of sharing of 24 years working in nonprofit
Wow.
at the local level, and that we are very intentional about the work that we're doing. G.R.E.E.N is gathering resources to educate and empower. And what does that really mean? It really means empowering. It means really to educate individuals how important health is, and health encompasses all of us, the wholeness of us, our state of mind, our physical, as well as our spiritual side. And so we do tap into all of those areas when we're reaching out into our communities. And the G.R.E.E.N Foundation serves as a vehicle to amplify the voices of the Black, African American, and Black immigrants. We provide the expertise and issues of Black communities throughout the state of California, serving as an intersectional, intergenerational, diverse table of exclusivity to discuss health equity, prevention to men and women and young adults, of course, to prepare pathways for community health education and to organize our networks, to continue to build on relationships, to be able to get messaging out to those who are in need, those who are not necessarily technologically advanced, those who may have some hesitancy of wanting to connect on a group level, but we try to reach the individual where they are. And I'm happy to say within our networks, we also want to increase or decrease, I should say, the disparities that are occurring and using the data that exists to reduce individuals of not getting the care that we all believe that we all are deserving. And so we provide a safety net. We provide a navigation system where we call it hand-holding, where if you contact us, we give you language to be able to make your appointment. We give you language how to use and access your health coverage, whether it is private or whether it is subsidized, it doesn't matter. We believe that you need to know your benefits to be able to continue to stay on a healthy journey.
Well, and I was just going to say, and thank you for that, Ernesta. I mean, just in the name green, the Green
Mhm.
Foundation, um, there's so much to unpack about that. And just, in kind of the last few minutes, we've come to learn a lot about your mission and how impactful your mission is. Um, and so we definitely want to spend some time, really looking at your programs and even looking at a little bit of how the Green Foundation came to be. But before we get into that, I'm wondering if you can just share a little bit about you, a little bit about your journey, what brought you to where you are today, the Green Foundation, and actually you're the founder of the Green Foundation. So walk us through just, a little bit of what has brought you to where you are today.
I would love to. How this occurred was actually residing in a business owner in Orange County for a number of years, and noted very strikingly that a lot of information pamphlets or workshops were not addressing the needs of the African American community. And so I did a little research to find out what organization was actually providing services in this particular space, and there was none. It was just a hit and miss, and oftentimes we're talked about as being hard to reach, which is a myth. It's not hard to reach. You need to connect with those particular communities and stakeholders in your community. So I looked at that and said, well, since there's not an existing program, well, it looks like I'm going to be up for a challenge. And I was more of a business major and an entrepreneur side than the nonprofit space, but I had a compassion for people who needed support and wasn't able to get it for a lot of and plethora of reasons. And so I just started looking into it, looking into the business model as a nonprofit, what was necessary. I spoke with other business leaders and other nonprofit organizations to be well informed before branching out into this space. And so it was a calling, quite frankly. It is my purpose that I stumbled on a need that was particularly in Orange County, and how it broadened from Orange County to Long Beach to cities in Los Angeles to Sacramento to Oakland. Once I started putting a curriculum in place and how it should look, that I believe, based upon touching base with experts, that other organizations and individuals says, how can we get it in our community? How can we have you guys to come in and share this information with us? And we started off with breast cancer. That was a space we started off with, breast cancer for women, because women were diagnosed, but there was no safety net, there was no plan. And there's always uniqueness of individuals needing unique services for that particular population. For a good example, when you have chemotherapy, well, sometimes, majority of the time, that will your hair will be lost. Well, African American women would not be able to use the same methods as other individuals, whether it's Caucasian, whether it's Latino or Asian. They have that uniqueness about who they are. And as we know that medicine is all customized, and so it's not a one size fit all. And so in talking to women who were diagnosed and getting an idea of what needs that they really needed, and to be supported, we started a support group to be able to have and discuss in openness and in a safe space of what some of their areas and issues are. And so then it went from breast cancer to prostate cancer. Then it went to about 5 other different cancers that highly impact African Americans. And then over time, it evolved into prevention of health diseases, period, among African Americans. And so it just blossomed based upon the need. And so we started developing comprehensive education programs and meeting with experts in those areas to bring them into a platform of formalized education for individuals to be able to talk to an expert, a medical doctor, a nurse, or an expert of mental health, to even licensed agents to talk about their health coverage and their benefits. And this was just springboard based upon the feedback from our partners as well as from our community of how we shape. And we are community driven. We believe in relationships and asking those we serve, what do you need from us? Because we're not all knowing. We're here as a service. So we learn a lot from the people we serve, and then we just uh, was able to adapt what we're learning and what we believe that needed to know, as well as learning from those to be able to help support them to shape the programs.
Absolutely. Thank you for all of that. I mean, I think that, what you're describing too, even in just answering the question, Ernesta, what brought you to today, it's you saw an opportunity. Really, you saw a need. You saw a
Mm-hmm.
huge gap.
Mm-hmm.
You're a social entrepreneur. You came in and you started to put together this network of providers, network of experts, connect to people in the community. So by way of what you're doing, I mean, people in the community have the resources. They have the experts that they can go to, but they also have this sense of community, right? I think that's
Mm-hmm.
another really important piece of what the Green Foundation is doing is that while sometimes I think when you're faced with a medical challenge or a situation, it can feel very isolating. But the Green Foundation is also looking to bring down that barrier, right? This is about building that community as well.
Yes. And through some of that is through our navigation support, where if they call us, and even though our emphasis is in African American and Black immigrants, anyone that contact us, we do not turn anyone away. We always get you to the next dot to help get you the support. And through the navigation is based upon each individual need. We are individuals who have expertise to guide you of what resource you may need, because we know that those who are diagnosed with any type of disease, that impacts your financial.
Yes.
Sometimes, no matter what your social economic is, that uh, 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 prevention as well as being diagnosed with a disease such as cancer or any disease that impacts your overall financial and family budget. And so we try to find ways to help support them in those areas, to locate sort resources in their area where they live, to tap into those resources. It could be from transportation, it could be for food banks, and also to let individuals know it's no shame if you're needing support. So that is some of the language that we share too, that we're here to support you. And that if we could save you money on, I don't know, food items that we get from the food bank, that's items that you could pay for your prescription.
Hmm.
That's money that you could use for Lyft or Uber to get you to your appointment because you're too weak, or your family is not able to take off to take you, to your appointment. So we do listen to the need of a client, of how to support them, and then we follow up. And then we sometimes, if they needing to talk to another individual that maybe have a similar diagnosis, that there are other peer-to-peer support that they can get on the phone and call to find out what did they do, how do they feel. So they have several ways of getting the support that they really need, and that I let them know it's okay to have the support, particularly, well, men and women, that we
Hmm.
find our ways, and particular in this world, that we have to be the big boy, the big girl, and we let them know you don't have to be the big girl, big boy by yourself. We're here to support you. If you need a few grocery items, don't be ashamed. You need to ask, and that we sometimes also know we'll just knock on your door and get it later. Go to your door to get your groceries. Go to your door to get the check so you can go buy yourself some nice orange juice or some items to recover from a procedure, because we do know that nutrition is so valuable in your recovery, or so
Yes.
valuable in prevention. And so those are other auxiliary type lessons of our listening and learning, how eating your medicine through your food, uh, fruits and vegetable, but also knowing too that it's not always available in all communities. And then look at ways of how to get the good nutritional groceries in your own pantry, and being creative. And so we give them some ideas of how to do that as well. And then we hold everyone accountable that this is your health. You are the CEO of your health. You do need to make your appointments. You do need to follow through and adhere to what the doctor have to say. And that we're here also to help you decipher what the doctor actually said. And so we just have the full circle of support for an individual who is needing the support for their healing journey, their prevention journey, that we're here to be able to be a listening ear as well as just a support system for no matter where they, no matter your journey on your health journey.
And how important it is to do that in ways that are very culturally affirming,
Mm-hmm.
that are respectful, that are also aligned to cultural practices. You know, I think people at the end of the day, they want to go to providers or in your case, you know, to kind of partners in the community that they feel they can really trust, that they feel, you know, will really understand what it's like to even sometimes kind of put words to challenges. Sometimes, you know, we have a hard time talking about what the problem is, but
Sure.
when you're able to do that in a way that affirms who you are, your culture, your background, I mean, that really makes a difference. And that's, I think, one of the things that the Green Foundation has also been very focused on, right? Making sure that people in the community know that they truly have a partner in this.
Yes, and the wonderful thing about it, you never know how much your impact is. So when we have our staff out at community events or out through outreach and some of our canvassing, that it is inevitable that the staff will come back and say, "Oh, we know about the Green Foundation. Oh, we know about Ernesta, or we know about the Green Foundation because they've been around for a number of years." That is our impact because we want to be visible in our communities to let them know that we are here as a support team. And so the only way that they know that we are here to help support them is to be visible, and that I'm encouraging all of our collaborative partners and our partners to do the same thing. We host community rallies where we invite other organizations that provide different type of services to come together, and let's just go out to the streets as a group to let people know that we're here. And the feedback from those individuals when we're knocking on doors or seeing people on the sidewalk or inside stores, they say, "We really appreciate it, that we see you, that it means that you really care." Just those small gestures is very important. So they're not seeing us just coming in for through funding and that we're going to go away. Absolutely not. We also share with them if we don't have any funding, we do not lose a community. It may be less amount of work what we may do, but we are never leaving the community, meaning we'll continue on Facebook, we continue to do rallies, we continue to work with our partners to let them know that we haven't gone away, that we're still here as a resource. And one other area that we've gotten some really good feedback is stay calm and stay informed, which we created when there was the pandemic
Mhm,
because people didn't know where to go. Mixed
mhm.
messaging, where do I go? Booster, no booster. I'm scared. I'm not doing that. Or all of the language and the nervousness, the concern, the fear. So we created a stay calm and stay informed to let them know here is where you can go to get a vaccination if you chose to, and a booster. Here is where you go to be informed and educated what that really means so you could have your own information to make your own decision. We pointed them to trusted organizations that actually had pop-up vaccination sites. And then we started wholeheartedly doing a lot of educating virtually by doing listening and learning sessions, roundtables, town hall meetings to help calm individuals' fear because we didn't want fear to not to go and get service that you needed. We wanted you to know what the symptoms were so it wouldn't get to a worse state where then you needed services that a hospital or a clinic are no longer able to provide service because it's been overwhelmed. So we were trying to get ahead of it where, and it's a hard copy document. We could send it out digitally as well as a hard copy when we did outreach and community engagement, even though we live in a technological age that we think that, oh, we'll just send an email. Well, when we're at a table, I don't want them to wait until we get back to the office or figure out an email. We wanted you to make a copy of it right there with your phone or hand out a hard copy. And then we encourage them, make copies, send it out to your family members and friends, send it to your grandparents or those who are isolated or they feel isolated. So we rally the troops, if you will, and empower individuals. You could help us get this message out to be able to save more lives. It was devastating as it was to the
Mm-hmm.
Black community with COVID, and it was
Yes.
very heartening, but we tried to stay as vigilant as possible to continue to let other community members know as well as individuals. So we used our database on an ongoing basis to send out slides every week to let them know that we are here and what they're able to do to help prevent or reduce their chances of getting COVID. And if they got COVID, it wasn't to be fearful. It is, how do we help you through it? How do we help your family through it? So we wanted to feel that affirming them culturally, affirming them from a family culture perspective of what African Americans and Blacks, as well as African from the diaspora, that we're a family unit. We don't
Yeah.
let go of you, that we are here to support you and we're here to support you all the way through the end, and here as a resource to calm nerves, because we also know in health, stress is not a friend. And so if we could alleviate some of the stressors of life and the fear that that we were going to get through it together, and that seemed to help support individuals. And so anytime we knew of resources, we were able to shoot that out into communities and into our partners to help them to help get the message out that help is here. We're going to help get through this collectively, and try to reduce the mortality rates of when COVID, and then now mortality rates for different types of diseases as well.
And just, working with the community, walking this journey with the community to identify, that oftentimes, as you were just saying, fear can be such a huge enemy. It can create such a big barrier in the minds of folks around, well, no, that isn't for me, or I can't do that, but you're really there to dissipate that and to provide a safe space whereby you're really giving information that is based on science, medicine,
Mm-hmm.
what the experts are saying. And therein, then folks can really make their decisions about which way to go. But then they also have a partner to walk with them in this journey around, wait, I'm here now. How do I make sense of this? How do I kind of sift through all the decisions that need to be made? As I'm listening to you, Ernesta, I can't help but think about how just the fact that you are there as a resource. We're not even taking a deep dive into your role as educator, because you are an educator as well,
Mm-hmm.
but just kind of sifting through the the different resources that are out there, education, even just holding on to or providing a space where people can come to you with questions, all manner of questions.
Mm-hmm.
And sometimes people don't know, because, when we're in stressful situations, sometimes we don't know kind of how to talk about our situation. But to know that there's somebody there in the community that can help kind of put some words around what's really going on, there's no value to that. The more I think we look at across the board where communities are now, the more we realize that, particularly from an organization's perspective, if you can build these relationships with community,
Mm-hmm.
if you're a trusted space, if you're truly seen, and you're there to be a partner, that is so invaluable. And I think in our transactional world, we tend to overlook those things, that relationships are really key and they're central to your work. And it sounds like, Green Foundation, you're smack dab in the middle of that.
Yeah, thank you. Yes, we are heavily into relationship. We know that we can't do it by ourselves, and that's what's in the name of through networks. And we know that in order for other partners who have wonderful product and services as well, that they also want to make sure that they align themselves with other partners who are providing a unique as well as authentic service, and that we could be added to their goodness bucket to be able to be a resource as well, that they would feel comfortable sending their clients to us. I just had a medical doctor to text me that there was a person who was disabled and needed to talk to someone with health coverage. That research has shown that health coverage is complicated for everybody. And so it could be very overwhelming, but we try to simplify it and to let people know based upon the law of 2016 of the Affordable Care Act law, that it's a law. These are some of your benefits. You need to be aware of your benefits, your essential benefits. There's 13 of them, to get to know that these are for prevention measures and that you will need to use them every year. For example, colonoscopy. A lot of individuals thought that they couldn't afford that $4,000 for an annual colonoscopy. Well, you don't need to worry about that with health coverage. No matter what your coverage is, it is covered. That is an essential benefit when you get a certain age, that you are able to get that procedure with no cost other than your copay or whatever your insurance is required. Well, colonoscopies is an essential benefit, so you shouldn't have to pay any cost or co-payment, because it's an essential benefit at a certain age. Or if I share with individuals that your doctor prescribes you a medication, ask the question. Do we give them advocacy? We give them empowerment. Ask the doctor, is there any complementary prescriptions that I could take to see if it's going to take my body, instead of spending $300 on a medication that may not work for you, or you have an adverse reaction. So we
That
give
is
them
so
like,
useful. Going in
yes,
with some kind of guide around, gosh, how do I even engage the doctor? How do I have this conversation? So, Ernesta, for individuals who are looking at this video, looking at this interview right now, what and they want to connect with you. What is really the best way to connect with you, especially if you're someone from the community and you want to access these services, or you want to know, I live in this community, can they help me? What would be the best way?
they could contact us via email, info at thegreenfoundation.net, or they can go to our website, www.thegreenfoundation.net. There's a form on the website as well. And all of our staff are trained within 24 hours. You will at least get a phone call or an email to let them know that we received your inquiry. But within 48 hours, you will get a phone call or email to ask, how do we help you? Where do you need support? And then we do intake forms of just identifying how do we help you? So we like to always find out, of course, where they live. So we could provide those support services where they live. I don't want to give you information where you have to get 2 buses over and a cab to get to the service. No, we will help you look. We tap into public health systems. We know that that is complicated as well. They have a plethora of resources, but who can navigate it? You have to know lingo. Someone may say, I need a ophthalmologist, but if you're not familiar with that terminology, you won't know to go look for an eye doctor, on the platform. So we help you navigate, but we teaching you as well. We also share how important if we give you a resource that you will need to follow up, that we also hold them accountable. So it's a bi-directional support. And if
Mm-hmm.
they are in need of us to talk to a physician on their behalf, we are there to be able to do that as well. We encourage to write questions down before the doctor's appointment. We teach you how to do that as well. We teach you how to take a buddy into that doctor's appointment because we do realize you get nervous and you may forget. So we teach as well, give them some tools to help support their journey. So
So
by
important.
contacting us, we
Mm-hmm.
let you know that we're here to walk you to the direction that you needing to go where you are. So it's okay. You don't need the language. We'll help figure that out. We don't want you to feel intimidated. We
Mm-hmm.
want to help you to get the results or the support that you're needing wherever you are in your service area or where you live.
And I
Um,
bet that a lot of these tools, these resources you're describing, you can probably even apply some of these outside of the medical, context as well when you're trying to just advocate for
absolutely.
yourself in other ways. So again, that email is info at
The Green Foundation.
thegreenfoundation.net.
Mhm,
And that's a great actually way of getting a hold of you because there are some others that may actually want to support your work. They may
mhm.
actually want to find ways to, how do we support the Green Foundation? So that email would also be a great way to connect with you. And you also have other information on your website as well.
Absolutely. And we're always looking for partners because there's resources out there. So we're always looking to identify individuals that have resources from toiletry items to kits to other workshops that we could refer other individuals to. So it's not just us looking for resources for the Green Foundation. We love partnering
Hmm.
and expand our database of our partners. We just always say if anyone contacts you, please contact them in 48 hours because when people call us, staff is trained, they need our help.
Right,
They
right,
don't need an excuse that for whatever reason whatever's happening to us, that it is a priority. If someone contacts us, it's a priority. They are in need and they're at a vulnerable state if they contact us. And we want to help alleviate some of that fear. We want to help alleviate some of the stresses in their life at the moment. Um, so we take it serious when someone contacts us.
absolutely. Thank you so much for describing all of that. As we close out the our conversation today, what would you like people to know about what's next for the Green Foundation? Any particular plans for the next year or the months to come?
Thank you, Carolina. Yes, that we have changed some of our strategy that from a conference platform to a community forum. We've been hosting conferences for since 2009, but looking at the new dynamics, looking at the need of our communities and the need and feedback that we've received, we're creating community forums where they are smaller in scope to be able to have a really good discussion on different types of topics, health topics, and that the spaces are always sacred as well as a place for a safe place to come to learn, and that no question is a dumb question, that we want people to know that they can get some of the answers that they've been needing to talk about in a space through our listening learning sessions, through the community forums that we will be continuously hosting. We host every quarter. We continue to partner with the experts, whether they're a medical doctor, whether they're a researcher or a social worker that specializes in a special area, that these forums and these platforms to learn about health is there for them to be able to learn right alongside of us. I learn all the time. And so we talk with our experts to let them know they need to use lay terms, and we're teaching them as well what community is needing. So when they go to their doctor's appointments, that they are learning as well, that you'll need to learn language, community language, and we also teach community. You need to learn the language as well to build your vocabulary in the medical and health space as well. So it's, again, it's a relationship, right? So if we could all learn together, that we could stay healthy together, it makes a healthier community. And that we also add fun. We also are creating ways of adding music to our learning opportunities. We're adding uniqueness of meditation and how that works. We're adding our spiritual side, that is not one size fit all. So it's not just presentations, which are only 15 to 20 minutes, because we want dialogue. We just don't want you to come and have a tick point like, did it? Absolutely not. We're here, and all of the education programs are developed that when you walk away, you have one thing that you can walk away and implement, or one thing that you could share with a family member. We want to know, did you learn something? So it's not just having a program. I'm not interested in that. I'm interested in a human side. Did you attend
Mm-hmm.
this conference feeling that you were supported in some way, and that you learned to be able to be a better you, or where resources can be, or where the resources are to be able to impact yourself as well as your family.
And helping people see what's really tangible then. Because the information was full, was rich, was wonderful. But what's that one tangible thing I can start to apply today? So again, to contact the Green Foundation, info at thegreenfoundation.net. Ernesta, it was a pleasure. Thank you so much for inspiring us with everything that the Green Foundation is doing today.
Thank you very much. It's my privilege. And those who need us, we're here to serve. Thank you.